Poe, there's a huge epidemic of healthcare workers who are burnt out.
Right.
Do you know this?
I did not know this. Yeah. Let's
Okay.
talk about that. Yeah.
Well, doctors have been burnt out for quite some time. Every year there's like a national survey done, and some specialties are more burnt out. Like primary care is very burnt out, has been and continues to be probably the most burnt out. And burnout, in medicine, actually, there's a newer term we use, not burnt out. We say moral injury. Burnout implies there's some fault of the person that you can't keep your flame going. Because why do people go into healthcare? I know so many people, you go to a room of people who are in healthcare and you ask them, and they all have, if you ask the whole room, like, did you feel called to serve? Almost everyone will raise their hand. That is something that bonds people in healthcare. I don't care who, nurses, paramedics, doctors, because a lot of the work is very hard. A lot of the demands on you are great. You are often in situations that are very stressful by choice. And the individuals you're with, both the patients and their families, they put a lot of demands on you. Emotions are high, expectations are high. And we do that by choice because there's a recognition that this is a deep need that we're helping to fulfill in society. Why then is there so much burnout? There's a disconnect between why people wanted to go in. They wanted to go into healthcare to help people, to serve and to heal. And we're not seeing our patients get better. Actually, we're seeing people get sicker. We talked a couple weeks ago about life expectancy going down in the United States. That's because of COVID, and it's because of the epidemic of chronic disease. More and more patients are coming in. There's more needs for services. There's more needs for cardiac surgery, for example, and for cardiac procedures to put stents in, and hospitals and healthcare systems are being stretched very thin. And as people have been leaving healthcare during the pandemic, there was, I think, this heroic phase. We were like, yeah, we're going to do this. We're going to push ourselves and serve society. And then that would be okay. But what people are experiencing in healthcare is, wow, people are just getting sicker. The system just feels so unsustainable. So rather than torment myself and subject myself to this, I'm just going to leave this. When they do that, it makes the rest of the people who are in the system stretched even more thin, right? And so to go back to what you said about the doctor's office sometimes feeling transactional, that I think is a survival skill now. I think that has become a way to survive in healthcare. And because the most readily, as I've said before, the most readily quick available treatment is a pill. And when you have such a huge volume of patients and you have such a
low amount of staff,
what are you going to do? And to go back to burnout, when you see constantly your patients not getting better and you're working in that environment, that's why we call it moral injury, because you can tell that what is best for the patient is, on some level, I think you feel it's not being done. It's when I'm not taking optimal care because it's not possible, because the system actually doesn't allow me to. That is the injury, the moral injury that we're experiencing. Lifestyle medicine it's a breath of fresh air. I think it's the antidote. It brings with it, I think, hope and the promise of helping people reverse disease and prevent disease and live healthy lives, live lives where they get to do and experience all the things that are important to them. That's what good health gives you. It's not just that it gives you health, it gives you the ability to live a good life. And then I went into primary care, Poe, and that system that you just described, I went into that. I think I had to experience that. I had to experience that firsthand. Now, that was never my intention when I became a doctor to be a primary care doctor. It didn't really resonate with me when I was in training, but that's because I think the way primary care is practiced by and large and continues to be in these very short visits, and you're covering a lot of information. You're basically going over illness and then managing illness, and you're doing that as quickly as you can to get through And you're developing relationships too. I think you tell most primary care doctors will tell you that they love their job because of their patients and the relationships they get to have with patients and the trust they get from their patients. And the reason that they're burnt out is because they don't get time with their patients. The demands on them now are so much in terms of volume of emails and paper. It's not paperwork anymore, it's computer work. There's so much charting, computer work, and messaging that the amount of time you actually spend with patients is very small. It's very, very small. And if you went into medicine because you wanted to serve and connect with people and see people get better and heal, and you're not experiencing that, you're seeing your patients actually get sicker, and you're not even spending time with them, and you're giving out more medications than you've ever given before, and your patients are not getting better, and that's because the medications don't treat the disease, they treat the symptoms of the disease. And you're seeing all that and you're experiencing it, and then your colleagues are leaving. It's a catastrophe. It's a crisis in healthcare. But I do see a future where the healthcare system is focused on health. It's focused on keeping people healthy, and it's focused on having these relationships with not just your doctor, but with your social worker and your therapist and your health coach and your dietitian and all the people that are part of your care team, who are all working to make you the best version of yourself, the healthiest version of yourself, so that you can live the life that's meaningful to you. That's the aspirational healthcare system.